Hi guys, I'm Dr. Andrew Iraniha. I'm a general surgeon, and my main interest is minimally invasive surgery, which is robotic and laparoscopic operations, which is a very hot topic now. General surgical problems are very common, and at times these problems are sometimes underdiagnosed or even undertreated. So my main goal here is to create some short educational videos for purpose of evaluating and understanding these surgical issues, and also the current surgical management for my patient and also other people that are interested. Obviously, if you want to know more in detail about this problem, you can visit my website at surgicaloasis.com or call my office 949-646-8444 for the surgical visits. Thank you. So today I'm going to talk about a very common problem called gallbladder disease. Gallbladder disease is so common in the whole world. Almost 10% of the female and 5% of the male they have gallstones, and among those 30% have symptoms that they end up to have some sort of a surgical intervention in the future. So as you can imagine, it's a very common problem. But let's talk about what gallbladder is, and I draw a little picture for you to understand the anatomy of the gallbladder, and then we're going to talk about the function of the gallbladder and then how we develop gallstones and what are the diseases of the gallbladder. So gallbladder is a tiny little structure located in the upper abdomen. In this picture, you can see the abdominal wall. This is the groin region, the umbilicus, and the chest is on the top, and this is the rib cage. So our liver is located right on the upper abdomen, which is actually protected mostly with our rib cage. And as you can see, I draw the little diaphragm right here. That's the diaphragm, and that's the rib cage in that region. So the liver is located in that area, and liver is responsible to produce a juice called bile, which contains a lot of minerals and also enzymes, which helps for the absorption and digestion of the food. This juice travels through this tube, the main tube, into the small intestine and mixed with the food from the stomach and helps for the absorption and digestion of the food. This tube is called a common bile duct, and that's a major structure that connects the liver to the small intestine. So on the way, there's a little sac located in that region. It's called gallbladder. It's a very small structure, and it's connected to this main tube by this little tube. And majority of times, some of these bile, instead of directly going to the small intestine, goes to the gallbladder and stores in the gallbladder. So essentially, our gallbladder is a tiny little storage, and when we eat, we produce a hormone inside our body that helps to contract the gallbladder and gives you a little boost of the bile into the system. Now, for exactly the same reason, because gallbladder is a storage for the bile, or a portion of the bile, some people have a tendency to develop gallstones. And the reason is the bile that sits inside the gallbladder, after many years, some of the components of the bile precipitates in the bottom of the gallbladder. They get together and they get dry, and you develop sludge, mud, or a stone. As an analogy, I always tell my patients, it's like having a pool and having a water in the pool and not filtering that pool for many, many years. And if you look at the bottom of the pool, you can see the dirt and some sludge on the bottom of the pool. So the same process exactly happened in our gallbladder. And essentially, this problem is more common in female than male, almost twice, and extremely common in the whole world. Now, when we eat and the gallbladder contracts, if you imagine and you have the stones right here, some of these stones move towards this end of this gallbladder right at the neck and can cause temporary obstruction of the gallbladder. And when you develop that, then the patient develops those symptoms of the gallbladder pain, which is usually in the upper abdomen, but can be right in the center of the abdomen, called epigastric region, and sometimes is associated with the radiation of the pain into the back or right shoulder. And these pains usually start between 30 to even 2 hours after eating a very fatty or very heavy meal. Now, there are other symptoms that are associated with the gallbladder problem, usually bloating, indigestion, reflux, and sometimes nausea. And some of the patients have all of these symptoms, and some of them have 1 or 2 of these symptoms. And when gallbladder relaxes after a short period of time, which usually takes around, again, 1 to 2 hours after eating, then this stone goes back into the gallbladder, and the discomfort and the pain and all those symptoms will disappear. So the nature of the gallbladder symptoms and presentations are very episodic, so they come and go. And some people, these episodes can come in every month or even multiple times through a week. And once this stone completely is stuck in that region and cause complete obstruction of the gallbladder, then that's the time that the gallbladder can get infection, and we call it a cholecystitis, or infection of the gallbladder. And majority of those people, they end up to go to the emergency room or seek surgical intervention. Now, the gallbladder disease also have some other side effects, or I would call it a complication related to the gallstones. So some of these gallstones also can travel and push into the main tube right in that region and create obstruction of the main tube. So the bile doesn't have any way to go to the small intestine, and it goes back into the blood, and then patient develops jaundice or yellow color in their eyes, and then the enzymes of the liver that we check during the visit, they go very high. And on the other hand, there's another structure located in this region called pancreas gland, which is also connected to this main tube through this little pancreatic duct. And it's responsible to produce a lot of enzymes for absorption of all of the nutrients in our body. And if you have an obstruction with a stone in the common bile duct, you can develop an obstruction of the pancreas, and then you can develop pancreatitis. So one of the side effects or complications related to the stone of the gallbladder is also pancreatitis. So those are the presentations that usually people can present normally to the emergency room. The function of the gallbladder is very minor, and a lot of times majority of bile goes directly from the liver to the small intestine for digestion and absorption of the food, and just a minor amount of the bile goes to the gallbladder. Gallbladder is a very tiny structure. So without the gallbladder, people essentially do fine, and risk after removing the gallbladder for people, as far as the digestion, is very, very minimal. So for diagnosis and treatment of the gallbladder disease, please see my other short videos. Thank you.